Good morning, everyone. Welcome to the first session of the March 2022 Advocacy Sector Conversation Series. My name is Melissa Hale, and I'm the manager of the Disability Advocacy Resource Unit. I would like to begin by acknowledging the Wurundjeri people of the Kulin Nation, the traditional custodians of the land on which I'm coming to you from today, and pay my respect to their elders past and present. I extend that respect to all First Nations people here today. We encourage your active participation today, so please type in your questions in the Q&A box, and at the end of the session, I will be facilitating a Q&A session with our presenter. So the first session for this series is on community attitudes toward people with a disability in Australia. Attitudes are linked to disability-based discrimination and social exclusion, which in turn impact the health and well-being of people with a disability. The Centre of Research Excellence in Disability and Health recently conducted the first national survey of community attitude toward people with disability. The survey, co-designed with people with disability, examined how people in Australia understand disabilities and their beliefs, attitudes and behaviours towards disability in a range of settings, including education and employment. In this session, one of the authors of the study, Dr. Georgina Sutherland, will discuss the findings of the survey and then tell us about where we need to focus our future efforts on across individual, organisational and structural levels of society. So please give a warm welcome to Dr. Georgina Sutherland.
Thanks, Melissa, and also to Natasha for extending this invitation to share our project and to unpack some of the findings of our report on a national survey of community attitudes towards people with disability in Australia. Really pleased to be part of this advocacy sector conversation series. I'm also joining you from Melbourne today, a very gloomy day in Melbourne. A little bit of rain just starting, but thankfully not as much as other parts of our country right now. Melbourne's the colonial name for the city where I live and work, and I would like to acknowledge that I am on the stolen lands of the Wurundjeri people and to pay my respects to elders past and present and to First Nations people on the call today, or joining the webinar, I should say. I'd also like to acknowledge that I'm presenting on behalf of quite a big team of researchers, both academic and community researchers, and some of this work actually commenced before I started in my role at the university. So I hope I can do justice to the huge amount of work that they did in this project. I'm using a clicker on my phone to move my slides, so excuse me if this... Oh, fabulous, it's working. Apart from the core research team, the project had a really broad group of contributors to the project, both formally through stakeholder consultations with disability advocate sector leaders who provided direct input into the survey, informally through other types of stakeholder engagement. And I'd like to specifically acknowledge Amaze for sharing their experiences of developing and implementing their survey, Australia's Attitudes and Behaviours Towards Autism, and also to our funders and to the survey participants who I'll talk about a little bit later in the survey. My plan today is not to take up the whole of the allocated time that I have, so that we can leave lots of times for questions and for comments. And what I want to do is to share with you some of the key findings, and as Melissa discussed, sort of unpack some of that in relation to implications, but also about the survey itself and our approach to developing it, because that's a really unique and important component of the work that we did. So why study attitudes? Why are they important? Melissa mentioned that attitudes can have a significant impact on the lives of people with disability because they are related to discrimination and act as a barrier to access and inclusion. And attitudes are shaped by lots of things, including everything really in the world around us, those that are close to us, family and friends, through communities and institutions like schools and workplaces, but are all around us in the way media portray people with disability and also in advertising, or sometimes attitudes are formed by the absence of people that we see in the world around us. When we really dive into the literature on attitudes, and that's not just the literature on attitudes to people with disability, but sort of the attitudes literature broadly, and we try to think about how attitudes link to behaviours and actions, it starts to get a little bit messy. It's not quite such a linear path between attitudes and behaviours, and particularly at the individual level. So often individually held attitudes aren't necessarily a particularly good predictor of individual actions, but rather people's behaviours are influenced largely by what they believe other people expect in particular social situations. And so attitudes can be quite dynamic and changeable, which is a good thing. They are amenable to change, but they can change in particular contexts that we're in as well. So at a society level, attitudes can tell us about what the community thinks is okay and what they think is not okay, but also what as a community we're prepared to tolerate or not tolerate. And they can also serve as like a barometer. So it's something that we can look at, we can measure over time, and we can see where the progress is being made and where we might need to focus on in the future. The importance of community attitudes in the lives of people with disability is now signalled in a couple of very key policy platforms in Australia. The first is Australia's National Disability Strategy that was released in December of last year, December of 2021. It's designed to cover sort of a decade of policy in Australia, and community attitudes in this particular iteration of the strategy was added in as one of the 7 outcome areas, but also explicitly acknowledged as being a cross-cutting theme. So a cross-cutting theme in relation to community attitudes play a really important role if the strategy is to achieve its vision across many of the other outcome areas. So in relation to employment, in relation to health, in relation to access to health care or access to justice. So a particularly important overarching issue in Australia's disability strategy. The second important policy platform is the Disability Royal Commission, the Royal Commission into Violence, Abuse, Neglect and Exploitation of People with Disability. And the Royal Commission has highlighted community attitudes as being highly relevant in relation both to responding to violence and abuse, but also the role that attitudes play in preventing violence and abuse from happening in the first place. So this is thinking about attitudes in relation to being an underlying determinant of the very high rates of violence that people with disability experience. What is missing currently from the sort of policy picture in Australia is a mechanism really to monitor and understand community attitudes towards people with disability. And although this project commenced before either of those 2 sort of really important policy platforms arrived in Australia, it has gained agency in terms of its relevance to these particular to policy and how that might be implemented. I'm going to do a bit of a deep dive into the survey, into how it was developed. So a survey called the Community Attitude Survey. It was development was guided by the principles of participatory research. By that I mean the concerns, experiences, perspectives and interests of people with disability and the disability sector or disability advocacy sector were central to the development process. And that was designed to ensure we had a survey that was relevant to the lives of people with disability in Australia. Really a very fundamental or core aspect of these principles, or particularly the principles of participatory research, was involving people with disability as part of the research team. So community researchers. Sometimes in research we might also refer to them as co-researchers. So not people with disability necessarily just in focus groups or as research participants or even as consultants, even though we did do that as part of this project. But what I mean by community researchers is people with disability embedded as a core component of the research project, bringing academic expertise together with lived experience expertise, learning from each other and jointly moving the research forward. And I make the point specifically about the distinction between co-research and consultation, because they are often used interchangeably, but they're actually not synonymous. The process of working with lived experience expertise in the research process also allows us to be deeply reflexive of our own practices and processes about what's around us, particularly in the university. And it was very telling as we were doing this project and as we were looking for community researchers to work with, involving them and being involved in the research process together, about some of the attitudes and some of the structures and practices, even within the university, that made it much more difficult for people with disability to be involved in research. So we were studying some of the barriers and what discrimination and exclusion. We're actually dealing with some of that ourselves in terms of sometimes the physical spaces at the university are not accessible, but other sorts of structures and processes, which means universities for a long time have excluded people with disability. So there really were four main components to the process of developing the survey. So we started with reviewing previous surveys on attitudes to disability to identify potential survey questions, to consider whether we wanted to use existing sort of psychometric scales, whether there was anything that was relevant, whether we wanted to look at other questions and take some pieces out of them. So it was really about reviewing what was already out there in terms of the existing literature. Then identifying the attitudes that were most relevant to measure in the Australian context. So what was really important for us to know about. This was facilitated also by conducting stakeholder interviews with leading disability advocates to guide the survey. The co-researchers conducted 10 stakeholder interviews face-to-face. These were pre-pandemic, so they could happen face-to-face, although there was some online and some by telephone. And the stakeholder contributions really helped to ensure that any findings that we had were really useful to the sector. But advocates also were very, contributed a lot to the development, helped us to refine questions so they were more understandable, so they were relevant, talked about ways, in some ways, some of the attitudes that surveys that exist are quite outdated, so reinforcing some of the negative or harmful attitudes that we know exist. And many also commented on their own experiences of attitudes, and that further informed the work we were doing in the survey. And then, of course, we drafted and finalised the survey. What we ended up with a survey is what we have described as a global set of attitudes, beliefs and assumptions and behaviours that impact on people with disability, rather than specifically ask questions about attitudes towards types of impairments. So we know that AMAZE have an attitude survey around autism. So we, rather than doing that, we instead thought about this global set of attitudes. But that was something that we had to really sort of pick through. And I've got here one of our stakeholders' comments about this. So this person has said, in our organisation, we don't make any distinction on the basis of disability. We put all people into that group. However, I'm conscious that people in the community have different responses and reactions to different types of disability, some more negative than others. And that there's a real issue in the community for people who have invisible disabilities. So I am aware of all those nuances. They need to be taken into account depending on how far such a survey wants to drill down. So these were some of the sort of questions and queries we had, and we had to think through an approach to take in this particular survey. Oh, I'm trying to click through on my computer, but that doesn't work. I need to use my phone. The survey is a series of statements that reflects respondents' own attitudes, so what we would refer to as personally held attitudes. as well as their understanding of what the wider community, or what their understanding of wider community attitudes towards people with disability. So if I'm looking at my screen, on my left-hand side, employers should be allowed to refuse to hire people with disability. We would consider that's worded in terms of eliciting a personal response. And then on the other side is people believe that people with disability find it harder to make friends. So that is eliciting from survey respondents what they maybe think the broader community thinks. It was designed specifically in this way because we know from research on attitudes that one of the major challenges to measuring particularly personally held attitudes is a tendency for respondents to feel like they need to choose socially acceptable responses, so what they might think is the right thing to say as opposed to true thoughts and feelings. We included some other information around the attitudes, so the sort of standard sort of approach to socio-demographic information, but also about whether people had social contact with people with disability, whether they had a friend or family member with a disability, whether they had a disability themselves. This is just a broad overview of the survey methodology as a whole. So survey respondents were members of the Life in Australia panel, which is managed by the Social Research Centre. And I've put a link in there, although that colour doesn't come out very well, but I'm happy to send people that if they're interested. And if people want to delve a bit into the statistical properties around generalisability and representativeness to the Australian population. So in April 2018, all of the active members of the Life in Australia panel were contacted and invited to participate in this survey. Around 70%, over 70%, so a total of 2,069 people did complete the survey, most online, with a small proportion completing the survey over the phone. All of the survey questions were worded in that sort of standard format that I'm sure people have seen if they've completed surveys, from anchored at either end with a strongly disagree and a strongly agree. We then recategorised those into 3 groups. So the strongly disagree and agree became disagree. We had the neutral response option, so people who neither agreed or disagreed. And then the strongly agree and agree were in a 3rd category. I'll just talk about some of the survey findings across some of the sort of key domains or key areas of interest that we're interested in. The first one is around common beliefs and touches upon expectations of exploitability and future prospects. So we can see that 20% agreed that people should not expect too much from people with disability. 63% agreed that people with disability are easy to take advantage of, to exploit or to treat badly. And 23% agreed that people with disability have less to look forward to than others. We also asked about this issue around burden that a lot of people talk to us with disability talk to us about in terms of attitudes and behaviours, and found that 9% of people agreed that people with disability are a burden on society, so quite a small proportion of the survey respondents. But 23%, so a quarter, agreed that people with disability are a burden on their families. And this is not something that people with disability just hear once, or it's not just a once-off attitude, but it's something that we hear from people talk about as an everyday occurrence. And I have a quote here from one of the stakeholders who talked to us about how this plays out for her when she's in the community. My partner's non-disabled, and people always think that she must be a fabulous, wonderful person, and she is. But she must be a fabulous, wonderful person for being with me, and she must do the majority of the domestic tasks, and I must be some burden. And one day she'll wake up and realise that I'm a wheelchair user and leave. I've had people say that to me. she hasn't realised yet. So somewhere down the track, she's going to wake up and go, oh, she doesn't stand up. Okay, I've got to get out of here. The next set of questions sort of coalesce around behaviours towards people with disability. So 63% agreed that people with disability are easy to exploit. 61% agreed that people often make fun of people with disability. And 41% agreed that people with disability are treated like they have no feelings. And to me, it feels like there's a bit of a conundrum here around interpretation, where on the one hand, do these responses reflect an awareness around discriminatory and exclusionary practices that people with disability experience? Or are they in and of themselves reflect stereotypical attitudes of people with disability as being vulnerable or flawed or in need of protection? And I would really argue that these attitudes around exploitability and vulnerability, and particularly around uncertainty, are very much entwined with and reinforce the attitudes around low expectations and burdens that were on the previous slide. I'll also show you this, so that might be a bit small for people to see, but I will show you this as a table that I've drawn specifically from the Victorian report, but is reflected in the national survey as well. And this is about interactions with people with disability in terms of what the survey respondents told us. So you can see there around on the first bar, there's around a third of people think people with disability are approachable. And then we have on the second bar, it rises up to sort of 3/4 of people say they're unsure about how to act towards people with disability. And then the third one is around a third are uncomfortable asking people with disability what supports they need. So it really plays into this idea, like there's this uncertainty around how you act, whether you approach people, what you say to people, whether you should ask people. And that, of course, has an impact on how people with disability feel in terms of inclusion and participating in the community. The final set of slides, or not the final set of slides, but these final sort of set of statements that I'm going to show you around inclusion across some key life domains, including actually some of the outcome areas that are in the new disability strategy. So 20% of people agreed that employees should be able to refuse to hire people with a disability. 13% agreed that children with disability should only be educated in special schools. 21% agreed that schools are accepting of children with disability. And 55% agreed that people with disability find it harder than others to make friends. So in summary, and it's really important to reiterate here that most respondents expressed inclusive or positive attitudes, particularly when asked about their individual perspectives or views. There was a proportion who demonstrated an awareness of the harmful attitudes and actions by other people, and that those actions can be exclusionary and discriminatory. There was a range of concerning findings, though, where a chunk of people reported attitudes that were either overtly negative or hold attitudes that are devaluing or patronising and discriminatory. Then there are some questions that we found quite difficult to interpret, and there's a range of reasons for that, but including where there was a large proportion of the survey respondents that selected the neutral response option. So at the start, I showed you the scale that people were able to respond on between agree, disagree, and we had this neutral response option where people could say they neither agreed or disagreed with the statement. So, for example, around a third of the survey respondents neither agreed or disagreed with the statement people with disability should not raise children. So my questions are around, is the neutral response option because they hold a negative attitude but know that it's not actually socially acceptable to say? Or is it that they don't actually hold a strong view, so they truly don't agree or disagree with that statement? But is this itself a negative attitude? Is choosing the positive negative? So there's some questions about what you do with those neutral response options. The low expectations and perceived burdens were a theme as we were developing the survey, a theme with stakeholders, and then were quite strongly supported through the survey findings, where there was low expectations and perceived burden as a negative attitude. And it has deep impacts on people with disability across all life domains. And there were some really interesting attitudes around school and the workplace, particular settings where I think there is opportunity for change to be made. I'm just going to touch on some strengths and limitations. This is why I have a scale here. There's always things that you can do better, things that you reflect on and think, oh, that we could do that a bit differently next time. But there's certainly strengths as well. The first national survey of its type, so a very useful baseline from which we can measure change. Our approach to developing the survey was modelled on really authentic co-design, and something that the team is particularly proud of, although came with its own set of challenges and allowed us to reflect on some of the structures within the university that are discriminatory and exclusionary. But several limitations also to consider, particularly in relation to neutral responses to survey questions, that makes sometimes some questions difficult to interpret. And I've looked at, there's some other national surveys. There's one that's been running for a really long time on community attitudes to violence against women. And I've sort of dug a bit into that survey to understand what they do with the neutral response options, and I haven't as yet found a solution to that. So I'd be interested to hear people's thoughts around that. What's next? We actually have it's a really rich source of data, the Community Attitude Survey, and with a bit more resource and a bit more time for us all, we'd really love to do a lot more with it, but we do have some plans. One of the plans is to look for some of the associations. For example, what are the associations between attitudes and social contact? So if you have a family, a friend with a disability, or if you have other types of social contact with people with disability, so you work with someone, have you had a teacher who's a disability? We're at school with someone with a disability, and think about how that impacts on people's attitudes. We'd like to further explore particular settings. As I mentioned, workplaces is one. I think we'd like to, from our experiences, we'd like to particularly explore that. But we also have some questions that allows us to explore perhaps if people are working in managerial roles or roles where they have the responsibility for hiring staff, looking at attitudes of that particular group to see if there's any opportunities where we can sort of target efforts for change. We'd also like to compare community attitudes towards people with disability with how people with disability actually experience those attitudes. So we did have a supplementary section that asked about some experience. There were some experiences questions. We had a student do a little bit of work on that towards the end of last year, and it's really complex, and we haven't quite worked out how to unpack that yet. So we're still working on that component. In terms of recommendations, I've just got some really broad ones here, but of course, invest in action. So this provides a really important sort of descriptive platform to understand what's going on, but there needs to be action around understanding now evidence-based or evidence-informed actions for change. So what can we do that is specifically relevant to changing these attitudes, changing how people with disability experience those attitudes, and exclusion, access, all of those things that we can change, but to explore that through policy, through legislative mechanisms, through social marketing. There's so much opportunities to put action, to invest in action in this space. We'd like to say to advocate for a real commitment to co-design, particularly in the National Disability Strategy. They have an outcomes framework around across the 7 outcome areas, including community attitudes. And they, will we assume monitor report progress across the life of the strategy, and particularly around community attitudes, and probably across all the outcome areas, really a commitment to co-design and inclusive processes. I also think that there needs to be action, which the Disability Royal Commission is really highlighting, the role of disability as an underlying or a driver of discrimination and inequality. So I think there's a lot of thought put into negative and harmful attitudes and their impact on access to services. But I think it would be really important if we start to consider attitudes as one of the underlying drivers or the underlying risk factors for discrimination and inequality for people with disability. And of course, it would be useful to really monitor this over time, to take the attitudinal sort of temperature really of the community and to see if things are changing. We have 2 reports that we produced from this work. The Victorian Government and the Department of Health and Human Services, as they were known at the time, were really particularly interested in the Victorian community attitudes and part of their state-based disability inclusion strategy. So we particularly looked at a Victorian population there and produced a report for the Victorian government, but also the survey was national. So then we've later produced this national report. They're very much in line, but there's a lot more detail there than I have spoken about today. So thank you very much, everyone, for your time today. And we now, I think, have plenty of time for questions, which is terrific.
Well, thank you very much, Georgina. I think before we go to questions, the first thing I'd like to highlight is that the slides and the recording from this session will be available on the Diary website as usual. But before we go to Q&A, I've got a few questions myself. So you mentioned that there's a huge interest in changing community attitude, which is correct. So there's a number of different policy movements, such as the National Disability Strategy, the Royal Commission State Disability Plan. So this is a big interest of mine around changing community attitudes. And one of the things you mentioned was basically 1/5 of the respondents think that employers should be allowed to refuse to hire a person with a disability. Do you think that this is an attitude, or is it the barriers that are put in everyone's place? Like the NDIS and EIF programs help people with disabilities be employed with the supports they need, but they definitely don't go far enough. And it will help to change attitudes and allow employers to test assumptions if there was support provided to people with disabilities to be able to be employed in the mainstream. So what are your thoughts on that?
Yeah, it's a great question and one that we grapple with. And as you would know, when we ask people about their attitudes, like the survey itself can't tell us why. They tell us what it is, but they don't tell us the what's underlying that. And that's really important to know. And I agree with all your comments there about the support that's potentially available to employers to be able to make modifications or to be able to have people with disability in their workplaces. My understanding, Melissa, is often they're not taken up by employers. So that there is state level and I think Commonwealth level funding available to support people, particularly employees, to employ people with disability, but that often those funds aren't used. So I also have some questions around why that is the case. You know, is it because there's an attitude there that it's like, well, this is too hard, irrespective of the potential financial and other supports I can receive? Or are the authorities that have these funds not providing enough information or incentive for employers to use them? And I feel like that's a bit of a frustration. Is that a sense that you get, that some of those funds just aren't accessed and used?
Yes, I think I agree with that. And I think there is a lack of knowledge around how it can be used and how it can be accessed, because a lot of employers don't know about it. And
Yeah,
then a lot of people going for jobs often don't know the full, like what they're fully entitled to as well, and how to resolve that problem I haven't really looked into. But I'll give you an example for a deaf person. I'm a deaf person myself, so this is my experience. If you use Auslan full time, you have access to $6,000 of Auslan interpreting per year, and that's it. And for some people, that's gone in a month. So then it's up to the employer to pay the rest of that. So that's a huge barrier. So I don't think it's more of an attitude. It's more of like, how are we going to do this thing? So
yeah.
that's just one thing I've grappled with for quite a while. How do we fix that?
I think that's a good
Yeah.
point, because we're talking here about, it's about individuals, but there's those structural barriers are, they're all intertwined. You can't unpack them. But certainly, I talked a bit about those structural barriers that we experienced just at the university, and this was just about physical spaces. This is finding a space that was accessible for someone in a wheelchair. So pretty basic stuff. That was actually a real challenge sometimes for the project team, to be able to find accessible spaces. So there is absolutely barriers at the structural level to inclusion.
Yeah, absolutely. And the other question I had was, how honest do you think people really were? So do you think that when they were reading the question, did guilt hold them back from saying what they really think? Because there seemed to be, from reading some of your statistics, there seemed to be a really high level of people being uncomfortable and lacking the knowledge of how to ask people what they need at that really basic level. And I found that really interesting.
Yeah. I found that interesting too. And I can't answer the question about the extent
No.
that they were honest, but it was raised with us numerous times through the consultation process about that. How do you sort of elicit really, really honest, sort of raw responses that people might feel a bit uncomfortable saying? And there's no actual way to do that. We did talk about, that the survey was anonymous, confidential. Stakeholders asked us to reiterate the importance of being honest, and that no one else would going to know what the responses were. And we've specifically avoided really characterising responses by sort of socio-demographic groups, so men and women, younger or older, if people speak English or not, because it doesn't seem like that's really a very big driver of attitude. So we weren't going to characterise people. So we did what we could around honesty, and part of that is, and other attitude surveys do this as well. It's like, well, what do you think people think? But then you start to difficult to then unpack what that means. So yeah, it's really challenging. It's really challenging.
Yeah, absolutely. And I'll just ask one more last question, and then I'll start going to the audience. The questions are coming in thick and fast. So what are some of the tools that you use to measure something that's not as easy to measure as number and statistics? So how do you measure something as feeling, as attitudes? So how do you do that?
Well, you do it through asking a whole lot of questions like we did. But there's other ways, like we've been doing some sort of participatory workshops. We're particularly interested in discriminatory and exclusionary attitudes that would lead to violence against women. And I don't mean directly lead to, but sort of some of the underpinning drivers of limiting independence and, control, those sorts of things. And And that is a really good way to understand the experience, how people experience attitudes is sort of coming from the other direction, and that's can be really insightful for particularly. I think what this survey can't do certainly can't do is talk about these attitudes are the experience of these attitudes for people with disability is an everyday occurrence. So it's something that the issue around low expectations, whether that be in the workforce, issues around seeing as a burden, comments people make in public, what happens in private, but it's everyday. Like it's an everyday harm for people with disability. So I think the other side of, when you flip the other side of the coin and you asked about experiences, that can be a really, really good complement to this sort of work, which has got its limitations.
Yeah, fantastic. Thank you for that. So I think we'll go to questions from the audience now. So can I please have the first question up on the screen? Great. So regarding question structure, were you saying that the team structured more evocative sentences, as in to leave more space to deviate from what might be socially expected to allow for more honesty?
No, we didn't. We didn't structure more evocative questions. We rather were asking questions about personally held attitudes and about what they think other people might think. So if you deviate from what's socially acceptable, you might go, oh, I think other people think that, and that's sort of the way that we were trying to elicit more, not more honest responses, but give people an opportunity to express both what they personally think, but also what they think their community or general society thinks. So no, we weren't being evocative, but maybe that's that's maybe something that we could consider. I don't know.
Stir the pot up a bit. Okay, great. Thank you. Next question. Will a national human rights charter assist in changing negative community attitudes? Is it that we are still looking at disability through a medical model lens?
What a huge question. That's a really great question. And I would really love to have more of a discussion about that. I'll take the second bit first. And I think it's safe to say yes, that we're still looking at disability through sort of a deficits lens, which is the medical model. But I think broadly it's thinking about deficits and not strengths. And I think, I mean, I do research in lots of different areas, and I think overall there is a tendency to always shift back to this sort of deficit medical model and not consider a disability as an interaction between an impairment and the sort of, attitudes are one of the sort of what's existing at the social level that is disabling. So I think for sure that is the case. Will a national human rights charter? I don't think I know the answer to that. Melissa, do you have? What do you think?
Well, that is a really, really good question. I congratulate whoever asked that question today, because the cynic in me says until our human rights charters have actual measures to hold people accountable, then no. Because I feel like our legislation today there's too many loopholes, there's too many ways to get away with things. There's too many ways for employers to exclude people with disabilities. So, yes, if it had teeth, and I would hope that something had teeth. I think that's the only way I could answer it in a nutshell. Yeah. Great question, whoever you are.
Such a good question. And it really
Next one, please.
it needs such needs much more unpacking than I can give that question justice to. But I do think, Melissa, the issues around accountability of things like charters and legislation, particularly those big overarching pieces of legislation that often, I don't know. I don't know. I find that there say lots of good things. There's lots of good things we should be doing, but whether they're how they are filtered down and enacted and then hold people accountable is it's a bit grey. I don't think I quite understand how that works.
Yeah, amazing. Next question. Regarding interaction links, can you speak more about what kind of interaction? So I think it's interactions. What kind of interaction did you have?
Is it relation to the questions? I'm not sure I know how to interpret that. Can you speak more about what kind of interactions? So it might have, some of the questions were, I'll speak to the survey findings, which were about the way people interacted with people with disability. So I'm going to guess it's in relation to some of the bar graph that I was showing about people being comfortable, whether they would approach people with a disability, and whether they would ask, they were comfortable asking someone for support. They weren't situational in terms of, we weren't saying at work or in the street. So we didn't really delve into situational interactions, which I think maybe is what that question is trying to get to. But it's a good question for us to consider, because I do think when we talk about attitudes, and particularly the sort of social norms and expectations that underpin those. So if we go even further back through the social norms about how we're expected to act in society and how people think we should act, that sort of the context of that can be really important. So that's a good question, but we didn't explore it in a lot of detail. But it's something that I think we should consider unpacking a bit more.
Yeah. Thanks. And sorry, I keep looking to my side. I'm just making sure I get all the questions in. So, next question, please. Did the survey look at attitude towards people with disabilities within quote communities?
No, it didn't. It didn't break down attitudes in that sort of what we would sort of call that intersectional frame. So looking at particularly, and there's no doubt that there is people from CALD communities or First Nations people, that there are particular groups of people with disability that experience sort of multiple marginalities. Their experiences with discrimination and inequality are amplified, but we didn't specifically ask about that. We were sort of more about sort of this global set of attitudes towards people with disability. So we didn't ask about different sorts of impairments either, and we didn't ask about particular communities. Again, this webinar format is so frustrating, because I want to go, what do you think you'd find? The person who asked that question, I'm like, well, what do you think we would find there? That people, I'm guessing the question comes from thinking that people from, migrant and refugee communities might have, more negative attitudes in relation to how people act around them or those sorts of things. I'm guessing that that's sort of the impetus for that question, but I'd love to know.
Yeah, I know. It is really quite a shame when we're not in person at the moment. We'd normally do this in person, but the world has changed.
The world has
Next
changed.
question. If the demographics of people in question of their attitude of disabled people, is there any data or insight into the attitudes of disabled people with compounding barriers? For example, disabled women, disabled queer people, or young disabled people? So I think that question goes to the intersectionalities.
Yeah, it does. So we had the survey was a general community survey. So that came from the Life in Australia panel. And, within any general population, there will be a proportion of people who self-report having a disability. So we did ask those questions. So we have a percent of the sort of 2,000 plus people, and I think it was around 30% who identified as being disabled themselves. And they they answered the survey, but they also answered a supplementary section. So thinking about their experiences, which I think this question is getting to. So we do have that group, but of course, as you get smaller and smaller groups of people, and that's people with disability are a proportion again of the whole sample. And then if you think about experiences for disabled women, or like in the previous question, maybe experiences for people with culturally and linguistically diverse backgrounds or younger people, then we start to increasingly reduce our ability to really say meaningful things. So we haven't as yet looked into that. But again, it's a great question, and I think requires a specific project that is looking at people's experiences and what are their compounding barriers and what do these sort of layers of inequality and discrimination, how does that play out for people in terms of their lives? How does it impact them, particularly around if they're women, younger people, and people in, regional areas, people outside of, we're often very metrocentric in how we think about services and access and support. So thinking about regional people, but we can't do that within what we currently have.
Yeah, absolutely. We've got time for 2 more questions, so I'll bring up the next question. There is a question with the result. 6% of Australians had contact with a boss with a disability. Can you go into a bit what had contact with means, or a bit more on the implications of that?
Yeah, so there was, I presume you're referring to the report, which is fabulous that you've read it in detail. There wasn't, I don't recall there was any further, how can I put it? Sort of, if we said, did you have contact with a boss? We didn't say 6 months, 12 months, forever. So there wasn't a way of us knowing what had contact means. So it's again, when you do a survey of this kind, you can just you feel like you can you give people a phone book of questions that you really want to ask, but you can't often do that if you want to get responses from the general community. So I think that the last part of that sentence about the implications, I think there's probably definitely implications around what contact means, the relationships you share, perhaps the power within the relationship as well. So I think there's lots to unpack when we think about, we've sort of called it social contact, thinking about where you've had contact with people. But I think that there's a lot more to that than just, did you have someone? Did you have a teacher? Did you have a boss? What did that look like for you? So
I think that will be a really, really interesting question to explore, particularly the attitudes around having somebody with a disability and authority of somebody who doesn't have a disability, and trying to unpack honestly what that means for some people as well.
yeah.
So we'll go to the last question. How can there be a societal shift from the polarised responses to discrimination and exclusion of a majority of people with disabilities versus the attitude to the inspirational people, for example, with visible disabilities in sport and entertainment? So we're seeing, I think what this sort of relates to is that we're seeing a lot of inspirational people with visible disabilities in sports and entertainment as well. Dylan Alcott being one of them, someone who really loves their disability and is really empowering and a really positive role model. But how can we make sure that there's a shift from the responses to discrimination and exclusion of the majority of people with disabilities versus this is what people in the mainstream see? That is a very good question. Wow. People are
I
on
was
fire
about to
today.
I was about to say exactly the same thing. Like this is like hitting like the big issues, and also one of the issues that we do, the work I do on with women with disability, and this work in terms of the generally attitudes towards people with disability. We do hear this a lot, and it's about where the people with disability are visible in our society. So on television, in the media, and it is this sort of it is the inspirational, and then the negative connotations of that. That Stella Young so brilliantly articulated when she talked about inspiration and inspiration porn. But I think that it's the societal shift, that's huge, but the societal shift is that people, and of course what we're talking about really is the essence of what we're talking about today. And it's like when people with disability are not have discriminatory and exclusionary practices, and they're part of our society, they are the teachers and the employers, and they're not necessarily the fabulous tennis players, although we want them as well. But they play the roles in society that we all play. That's the societal shift that we want. How we do that is a really enormous question that I certainly don't have the capacity to answer. But I do think that in the slide I had about a call to action, because I think we don't need to describe this anymore. I think we need to track it, but I don't think we need to talk about that there are discriminatory or exclusionary attitudes. I don't think we need to talk about anymore the extent to which people with disability feel excluded from society. I think we know that, and I think we've known it for a really long time. So I think that there is definitely a call to action that's required, rather than continuing to describe a problem that we know exists and has existed for a really long time.
Yeah. Well, thank you very much, Georgina. What an incredible session. That's great work. And you know what? The first national survey, and I'm sure it's only the beginning. So thank you very, very much for your time to bring this presentation to us today.
Thanks, Melissa. Thanks for having me, everyone.
Thank you. So everybody, we've come to a close for our first session of the series. I hope you've had a great time. I definitely have. So it was a very important topic. So thank you to the Auslan interpreters and captioners for their hard work today. Thank you to Show Division for bringing this production to you today. Have a wonderful week, everyone, and we'll see you next time.